Hey guys, I'm Kelly, the nurse who questions. Today I want to talk about Lyme disease. Not just as a diagnosis, but as a question. And more specifically, why do some questions about Lyme disease make people really uncomfortable? This episode is about patterns, history, and the uneasy space where medicine, biology, and power overlap. Lyme disease was first identified in the mid-1970s in Lyme, Connecticut, when an unusual cluster of kids developed what looked like juvenile arthritis. That matters, so I want you to keep that in the back of your reptilian brain. Because in medicine, clusters are supposed to make us curious, and geography adds a whole nother layer to this, in my opinion. But who am I? I'm just the nurse who questions. Just miles off of the Connecticut coast sits Plum Island, home to Lab 257, which is a government research facility that for decades studied animal diseases and transmission vectors, including ticks. That part's all documented. I dare you to look it up. The lab's mission was to protect livestock and food supply. What's more controversial is what else may have been studied there. In the book Bitten by Chris Newby, she explores declassified documents and interviews, suggesting after World War II, some Nazi scientists involved in biological warfare research were brought to the United States under programs like Operation Paperclip. That's historical fact. You should look it up before the government decides to take down another statue or destroy some buildings. And I'm not even talking about Tower 7. The unanswered part is how deeply their research interests, particularly around vectors like ticks, carried forward. From a biowarfare perspective, ticks are disturbingly effective. They're hard to detect. They can carry multiple pathogens. They spread illness slowly and unevenly. That's not conspiracy, that's basic military logic. To be clear, there is no definitive proof that Lyme disease was intentionally engineered, because I know that our government would never do something like that, ever. But here's where my nurse brain and my lived experience goes, and I can't particularly disengage with this subject. I know too many people who have been affected by it. I actually worked with a psychiatrist for many years. I won't disclose his name, but he's a Libra. He's grounded and he's not prone to wild thinking. I'll just say that. And one day, completely casually, he walked into the med room, half joking, maybe the majority of mental illness cases have to do with Lyme disease. There's just so much we don't know. And then he laughed it off and walked out. And I remember standing there with my other nurse friend who witnessed this, and I thought, I bet a part of him actually believes that. Because when you've worked long enough in medicine, you start to notice patterns you can't quite prove. You see mood changes, cognitive shifts, anxiety, depression, psychosis. And you also see how often underlying infections, inflammation, and immune responses are never fully ruled out. That doesn't mean Lyme causes most mental illness. It means the story might be a little more complex than our categories allow. And complexity makes people uncomfortable. Then there's Montauk. Reports over the years of strange animal remains washing up on the beaches. Sometimes described as looking hybrid, half rat, half deer creatures, often dismissed as decomposed wildlife. And maybe that's all they are. Maybe. But Montauk sits right near Plum Island, and history shows us that biological anomalies are always almost minimized until enough time passes for documents to surface. That pattern is familiar. Tuskegee, Agent Orange, radiation exposure experiments, Operation Paperclip, all later confirmed truth. How you like them apples? Oof. Meanwhile, many people with chronic Lyme symptoms are still dismissed, told it's anxiety, trauma, you're being somatic. And that brings me to another layer that's almost impossible to ignore. Chronic Lyme disease. A large portion of the medical community does not recognize chronic Lyme disease as a distinct or ongoing infection. Instead, it's often labeled as post-treatment Lyme syndrome or attributed to something else entirely. And because of that, many patients are left in a kind of medical no man's land. And what happens next is kind of telling. People who continue to suffer fatigue, pain, cognitive changes, mood shifts. often have to seek out Lyme literate specialists, doctors who operate outside of mainstream guidelines. These physicians are controversial, closely scrutinized, and in a lot of cases have faced investigations or even have lost their licenses in ways that fall outside of accepted protocols. That alone should make people pause. Because when doctors are punished for trying to help patients that medicine doesn't have clean answers for, it raises a hard question. Is the problem reckless care or rigid systems? Most of these treatments that these patients pursue aren't even covered by insurance, so they have to pay out of pocket. Thousands of dollars, sometimes tens of thousands. Not because it's trendy, but they are so desperate to feel functional again. And whether you believe chronic Lyme exists or not, their suffering does. The financial strain does. The isolation does. And as a nurse, that's the part I can't dismiss. And guess what? There's even another layer that makes Lyme disease so freaking complicated. Testing. Most people start with the typical tick bite check. But here's the catch to that. The majority of people with Lyme disease don't ever develop the classic typical bullseye rash. And then ticks often go unnoticed. That means initial suspicion can be entirely missed. And if a doctor suspects Lyme, they'll run a titer and possibly a Western blot and ELISA testing if you have a competent doctor. These are designed to detect the antibodies that your body produces against the bacteria. So that sounds wicked straightforward, right? But the reality is messy. These tests don't always pick up active infection, especially in the early stages, or in patients with chronic Lyme symptoms. False negatives are very common. Insurance coverage complicates matters even further. Many of these tests, or repeated testing for chronic or lingering Lyme, aren't covered. I wonder why that is. Then there are these things called co-infections. Oh my God. A single tick bite can transmit multiple pathogens. We're talking about Babesia, a malaria-like parasite, Bartonella, sometimes called cat scratch fever, and the list goes on and on and on. There are lots of co-infections to deal with. Each of these infections can mimic or worsen Lyme symptoms, and each often requires its own testing and treatment. Again, mostly paid out of pocket. Insurance companies ain't covering that shit. It's not like you pay enough each month for health insurance. So that means patients aren't just dealing with one elusive disease. They're navigating a maze of testing, insurance hurdles, and then you got overlapping infections. Merry Christmas. All while mainstream medicine often says, it's just anxiety. Here, take this SSRI. You'll feel better. Yum, 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 yum. As a nurse, watching patients struggle through the system for years, it's honestly heartbreaking. Because I believe them, and I don't think it's attention-seeking, and I don't think they're somatic. And it's another reason why curiosity, questioning, and careful observation are so crucial in medicine. Because if you dismiss complexity, you dismiss the people living it. Because medicine is supposed to meet people where certainty ends, not abandon them there. That's not speculation. That's happening now. So maybe the most important question isn't, did Lyme disease come from a lab? Didn't something else come from a lab too, and we were told? That was ludicrous! Maybe it's this question instead. Why does curiosity about origin feel more threatening than patient suffering? Because questioning is an anti-science. It's honestly how science is supposed to work. I'm not asking you to believe a theory. I'm asking you to notice history, to notice the patterns, and to sit with the discomfort of what we don't yet understand. Because sometimes truth doesn't arrive as an answer. Sometimes it arrives as a question that we were finally brave enough to ask.